70 million people in the world suffer from eating disorders. Although most think that eating disorders only applies to females, 10 to 15% of those affected are in fact male. In Singapore, the number of people affected by eating disorders is increasing. From 2011 to 2013, scientists from SGH mentioned that there was a significant jump in the number of patients fighting eating disorders such as anorexia. KK Women's and Children's Hospital mentioned that the number of patients affected by eating disorders rose by a staggering 30% in the span of 5 years. What is most concerning is the age of the patients. Scientists from NUH have noted that the patients are getting younger and younger, with 20% more cases involving students.
Singapore General Hospital is one where an eating disorder program is offered. According to them, 95 youths aged from 13 to 19 suffered from anorexia or bulimia in 2013, an increase from 65 from 2011 and 75 from 2010. Of these cases, at least 30 of them needed hospitalization. The amount of youths admitted to hospitals due to eating disorders outpaces the amount of adult patients, which also increased to 70 in 2012 from 40 in 2008. Due to the complex and overwhelming nature of this disorder, this is a worrying trend. Another point worth noting is the fatality rate of eating disorders is relatively high. Dr. Lee E. Lian, who founded the eating disorder program at SGH, stated that the eating disorder mortality rate in the world varies between 5 and 20%. The problem here in Singapore has also been a serious one, with one patient, usually young, being lost anecdotally.
To gain a deeper understanding and gauge of this project, we crafted a survey to find out the response from the general public. This is to give us different points of views towards this topic of eating disorders. Through a survey of more than 50 people, we found out the severity and opinions about eating disorders in Singapore. 74.1%, more than half of our respondents, agree that eating disorders are prevalent in today's society. However, it is important to note that about 12% strongly disagree that it is a problem or were uncertain of the answer. On a related note, a low self-esteem as well as the false notion about a good body size publicized by the media are seen as the main causes of eating disorders, with more than 60% believing in both of the causes, supporting our secondary data collected via the internet. Most of our respondents also gave a rating of 8 towards how dangerous eating disorders are to one's health. This shows the public understands the dangers of the issue and hence should be combated effectively and efficiently. Some of our respondents also really gave examples of their peers, stating examples such as how one skipped meals and ate irregularly due to the fact that she wanted to be a model, coupled with facing a lot of stress. Others include one suffering from anorexia because of low self-esteem and how her friend kept saying she was too fat. Another stated that her friend felt guilty for always binge eating and felt insecure about her weight, hence puking at night while everyone's sleeping. Lastly, one was overly conscious about their body image and therefore became anorexic.
Okay, can you name a few eating disorders in Singapore?
Eating disorders.
Yeah.
Eat too much fried food.
Obesity.
Then
What do you think is the main cause of these eating disorders?
social, those when they see those models and they actually got influenced by it.
On a scale of 1 to 10, how prevalent do you think these eating disorders are in Singapore?
4?
On a 4.
Yeah.
Okay. Do you think these conditions are dangerous to oneself?
Yes.
What do you think can be done to combat these conditions in Singapore?
Awareness? I mean, it just feels like awareness.
We also managed to interview some members of the public. The first interview shows how some of the Singaporeans do not understand the concept of eating disorders and confuse it with the consumption of unhealthy food, making it an overlooked social issue in Singapore. This was further emphasized when awareness was cited as one of the solutions to the problem, emphasizing on how this issue has been overlooked. It is also important to note the 4 rating given when asked how prevalent eating disorders in societies are in today's context. Furthermore, the second interview supported our survey data in saying that people are affected by models or the false notion of a perfect body.
Although we weren't granted an interview with the staff of the SGH, we managed to interview a PhD student in this field of research. The interview was meant to address the issue of the prevalence of eating disorders and how they affect different groups differently. We were also able to understand the reasons why eating disorders are common. This includes westernization and how people blindly follow trends set by others. She addressed the issue of why this problem goes severely unnoticed in the Asian countries. It is due to the notion that these eating disorders only affect the West. This shows how we are not acting according to expected to get rid of these eating disorders. However, she also said that the cause of these eating disorders have many roots. Moreover, she touched on the subject of treating those affected by these eating disorders. She suggested that a whole section of hospitals be utilised mainly for this cause, so that these medical institutions are able to use multiple ways to treat these patients, both medically and psychologically.
Cases reported and admitted to hospitals, but just the tip of the iceberg. Our doctors believe that the patients with eating disorders might not report it at all. In many cases, surface when disorders have become too serious a case. The effect of eating disorders are irreversible and life-threatening, and we should all stay vigilant in identifying those who need treatment and help. In Singapore, where food is readily available, one would expect Singaporeans to eat well and live well. We seldom see others suffering from eating disorders in our daily lives and grow up with the preconceived notion that eating disorders does not affect us. We oversee this problem, we oversee its consequences.